Our overall goal is to try to decriminalize mental illness, in that there are certainly times where someone who does have some type of mental illness does commit a crime, and jail is the appropriate answer for the immediate needs of the community and that person. But there are many times where if we can spend a little bit more time helping an individual get the resources they really need, we can avoid jail in the first place. There are plenty of times where someone is experiencing some type of mental health issue, but they aren't necessarily reached the level where they are likely to harm themselves or someone else. And at that point, that becomes more of an exercise in convincing them to get some help, trying to get them to cooperate with you. And that's where it really comes down to the individual officers on the scene, or a Valeo resource, someone that can come out and actually talk with the person and kind of convince them that maybe, at least this time, it'd be good to go have a talk with someone and see what resources might be available to help them.
I have really seen that people need this because they won't reach out for themselves because they're scared or don't trust the system. And with this program, it just is building the rapport and just seeing how happy and how they can change their lifestyle.
It's really about providing a safer environment throughout the community for not just the people that experience the mental illness crisis, but also for everyone in the community. If we can address these issues before they reach kind of a bullying point where there has to be some kind of police interaction, and be proactive about it, I think we're serving everybody better.
When I'm working with these people and can see the change and see that they're getting the help they need and are stabilized and able to do their daily living and be able to cope by themselves, and it's amazing. I don't know, because some of these people, it's been years since they've been stable or been able to have communication with their friends or family because they've pushed away from everyone and all their supports. So it's amazing to see the difference.
20, 30 years ago, police officers, they didn't do a lot with regard to mental illness. I know here in Topeka, it was common for if someone was in some type of crisis, the police officers would go out, they'd pick them up, they'd take them to Topeka State Hospital, they'd drop them off, and they'd be on their way. And that'd be the end of it. Well, things have changed a lot since then, and we have to find smarter ways of dealing with the problems and helping people while they're still out in the community.